Today, I'll be working with my client, Kimberly, on exercises that improve laryngeal closure. Appropriate laryngeal closure is absolutely crucial during swallowing because laryngeal closure is a part of the airway protection mechanism that prevents food or liquids from escaping down into the airway. So our first exercise we'll be doing today is called the pushing exercise. So Kimberly is going to demonstrate this exercise for me. So I want you to take a deep breath in, hold your breath, and I want you to push down on your chair. Now release and relax. Great job. Our second exercise is called the pulling exercise. So I want you to take a deep breath in, hold your breath, and pull up on your chair. Now release and relax. Great job! So these exercises should be implemented for patients with swallowing difficulties that specifically include poor laryngeal closure and or suffered previous laryngeal trauma, putting them at risk for aspiration. Different conditions that can lead to laryngeal closure deficits include stroke, neurological diseases such as Parkinson's disease or ALS, muscular dystrophy, esophageal obstruction, and head or neck cancer. As previously stated, these exercises are used to help strengthen the muscles of the larynx for proper airway protection. When you swallow, the muscles of the larynx elevate and adduct tightly to prevent the passage of food or liquid into the airway. If the muscles of the larynx are not fully adducted during this phase of the swallow, it is possible that food or liquid will escape into the airway, causing aspiration. Therefore, it is important to strengthen the muscles of the larynx through these exercises to ensure proper airway protection and to prevent aspiration. There is very little research currently available about the efficacy of laryngeal adduction exercises for dysphagia patients. According to Johns Hopkins Medicine's website, these swallowing exercises can be used to improve the strength, mobility, and control of laryngeal muscles, which will in turn improve the airway protection mechanism and reduce the risk of aspiration or penetration. Their website also notes that repeating these exercises daily for an extended period of time can eventually lead to normal swallowing function. A study completed by Fujimaki et al. That evaluated the effects of vocal exercises on elderly individuals with glottal closure insufficiency noted that 3 patients in their study showed increased adduction of the false vocal folds and laryngeal muscles. The patients in this particular study utilized these pushing and pulling exercises, which helped with the increased adduction of the laryngeal muscles, indicating that these exercises would be effective for patients with decreased laryngeal adduction. Thank you for watching! A study performed by Fujimaki et al. Today, I will be working. I don't know what to do.
So now I want you to gently, dang it! This is too redundant.
Oh my gosh. Gently place a finger on the back.
Good. You should feel as squeeze into